Well, howdy, folks. Welcome back to another episode of the podcast. Awesome question on tap for today, folks. This is from Kirk. Thank you very much, Kirk, first of all, for the question. I wonder if we can will things through the barrier. When they say barrier, they mean the blood-brain barrier. With meditation and persistence. Interesting. Let's break it down. So to my knowledge, and I also did some research to find any scientific literature backing this up, no, I was unable to find any information that we can open the blood-brain barrier on demand. However, when I first read your question so long ago, it takes me a while to reply to these sometimes, folks, it reminded me of literature that I read talking about the use of sound waves to temporarily open the blood-brain barrier. So due to that, I thought, wait, I use music or like people talking, like a guided meditation when I do meditate, which is not nearly enough. And there are a lot of people that use the same to meditate. So I said, meditation, sound waves. I remember reading about how sound waves could temporarily open the blood-brain barrier. To me, they're related. So I don't think it's exactly on about your question, but I think they're related, so we're going to run with it. How can sound waves be used to temporarily open the blood-brain barrier? So first of all, what is the blood-brain barrier? I'll pop a link to a video because I've talked about the blood-brain barrier before. So if you want, I guess, a little bit more in-depth, you can watch the video. I'm just going to go over it briefly here. But it's in the name. It is a barrier between the blood and the brain, and it prevents potential harmful substances from going from the blood into the brain. But at the same time, it allows vital substances to pass through. Example would be oxygen. Oxygen can diffuse right through the blood-brain barrier because we need oxygen. It's pretty important. Right? Carbon dioxide can go from the brain back into the blood so then we can exhale it. Right? So what is the blood-brain barrier? Like what makes up the blood-brain barrier? So all the blood vessels, especially the capillaries that run through the brain, well, lining the walls of those capillaries are endothelial cells, right? That's part of the blood-brain barrier. Now, in between those endothelial cells are proteins. There's a number of proteins, and those proteins are called tight junctions. And what the tight junctions do is it helps to prevent paracellular transport, meaning that substances can't go in between the endothelial cells to get into the brain. So in order for something to pass the blood-brain barrier, it has to, just like what I said with oxygen, diffuse through the endothelial cells. So it has to be fat soluble, or if it's a vital substance, like for example, glucose, which is water soluble, so it can't diffuse through the endothelial cells. There are specific transporters, like doorways, that allow glucose to get into and through the endothelial cells to eventually get into the brain. So it has to be kind of one or the other. All right. So that's the blood-brain barrier. Now, with regards to the sound waves that could temporarily open the blood-brain barrier, I'll pop one of the articles that I read up here. A focused ultrasound, because ultrasound uses sound waves, has been used to temporarily open the blood-brain barrier. Now, this is in a medical scenario, right? 3 examples of why this would be important is 1, somebody suffering from Parkinson's disease, or number 2, somebody suffering from like Alzheimer's, or 3, somebody with a brain tumor or unfortunately like brain cancer. Well, the blood-brain barrier prevents potentially harmful substances from getting through, but it can't separate what a harmful substance, like maybe bacteria or something, from getting into the brain. between that and a vital substance like medication to treat the symptoms of Parkinson's or treat the symptoms of Alzheimer's or help shrink the tumor. It's going to potentially reduce the amount of that medication that can get through or prevent it altogether. You can't tell the difference between what's really harmful and then something that could help improve the quality of life or help keep us alive. All right, so you have to either, one, find a way to temporarily open the blood-brain barrier, which we're going to talk about, or engineer drugs to be able to pass through the blood-brain barrier. So the focus ultrasound. Right? So again, ultrasound uses sound waves. So in any type of imaging, or at least most imaging, they're going to provide a contrast. Now, I can give you an example of what I went through when I was sick and they wanted to check my digestive system to see if there was any blockages or anything wrong with my digestive system, to see if that was a reason or maybe the reason why I was sick, is I had to drink a barium shake. Now, it would not do well on the supplement market. It's very chalky. It does not taste very good. And I'm usually not a big stickler for taste, but yeah, that was not very good. But you drink this barium shake and then it coats my esophagus, goes to the stomach, the intestines. And if you're using like an imaging, like a CT scan, well, it's using x-rays. Well, the x-rays are unable to pass through the barium. So when the doctor looks at the imaging, the barium provides a contrast to the rest of the body. Since the barium can't pass through, it lights up on the imaging and they can see, do I have a tumor or some sort of blockage in my digestive system? And then the rest of the body, the x-rays can pass through. So then, it provides a contrast. All right. So it's easy for the doctors to look at what they're trying to see, the particular organs or part of the body they're trying to see. Well, that's like a contrast, like a normal sense, so to speak. But with the focus ultrasound, the contrast contains microbubbles. Now, when I say micro, we're talking the bubbles have a diameter of nanometers, so very small. They're smaller than a red blood cell, okay? And as they're hitting it with the focus ultrasound, and let me talk about that. When I say focused, I'll use me as the guinea pig. So let's say the doctors want to open the blood-brain barrier, right? And I'm going to look right at myself so I can see what I'm pointing at, right here at the top of my forehead. They want to open the area of the brain right there, okay? So they will focus the ultrasound right there at that part of my head. Well, as the sound waves go through and then they will hit these microbubbles, it causes cavitation. So that's the shrinking of the microbubble and then the expansion of the microbubble. So I'll put up a picture of a sound wave here. So you can see as the wave goes up, you have compression, okay? And that's because as the waves were hitting the bubbles, or it's going through my head, then it's causing an area of high pressure. So it causes the bubble to shrink, right? You get compression. Well, as the wave goes through, it passes through the blood-brain barrier and then goes into the rest of my head, then the pressure drops because the wave is passing, all right? And so that is called rarefaction, and that causes the microbubble to expand. So then as these waves are hitting it, you're getting this continuous shrinkage, expansion, shrinkage, expansion. It could also cause oscillation, like the bubble to move around. And what that's doing is because of that cavitation and oscillation, it releases energy. And that energy is putting pressure on the endothelial cells and the tight junctions in between the endothelial cells. And then it causes them to separate. So now you have a gap to where the medication for Parkinson's or for Alzheimer's or to shrink the tumor, now they can have direct access from the blood into the brain. Now it's like Goldilocks. The intensity of the ultrasound has to be just right, because if it's not enough intensity, it's not enough pressure in order to separate the blood-brain barrier from the tight junctions. If it's too much intensity, you could permanently damage the blood-brain barrier, which is no bueno. So again, it's like Goldilocks. You want to make sure it's just right, because when it's just right, you get that separation, administer the drugs, they can get through to the brain, and then in about 4 hours, the tight junctions will reattach to the endothelial cells, and then you have a fully functional blood-brain barrier again. So, yeah, medical advances are wonderful. That really doesn't directly answer your question, but I thought it was related, so I thought it was interesting information to convey. So, yeah, I hope that was beneficial. If it was, please like, comment, subscribe. If you didn't find it valuable, then give it a thumbs down or dislike it and tell me that you didn't like it. Just be honest. I love the I love the bad comments, I guess, so to speak, for lack of a better term. I love all the comments. I love all the likes, but I especially like the people who disagree with me. I'll say it that way. Those are the best, because I learned something and they learned something. Hopefully they learned something. Hopefully I learned something, but oh well, I'm rambling here. Thanks again for liking liking, I guess that. But thank you so much for watching and or listening. And until next time, go meditate, folks. I'm going to go meditate. All right. Bye-bye.